The Bladder Exstrophy program is not just the surgery. At UH Rainbow Babies and Children, it's a whole journey.
Bladder exstrophy is actually a very rare condition, affects about 1 in 50,000 children. It's a condition basically where the bladder is on the outside of the child's body. It affects not just the bladder, but it also affects the genitalia. So if a child's got bladder exstrophy, effectively means that they have no control at all of their bladder. Therefore, these children are completely incontinent of urine. So in order for them to have any kind of normal life in terms of control of urine, in terms of sexual function, etc., they need to undergo surgery.
The treatment options are always surgical. The reconstructions that are performed may vary in the age at which they are performed, but the surgical steps are pretty much always the same. It implies a bladder closure, it requires some external genitalia reconstruction, and often continence procedure.
In terms of treatment, here in the United States, there's essentially two main schools of thought. There are those centres where the children have what's called stage surgery, and then you've got the complete one-stage approach. That's the other type of surgery where no surgery is done initially, and then at several months of age, they undertake a complete repair.
In the US, there are two types of surgery. The rest of the world, it's moving from that kind of surgery that has probably 20 years ago to some kind of surgery called the Kelly approach.
The Kelly procedure is an approach to managing bladder exstrophy, which differs slightly from the other two approaches. The main benefit of doing the Kelly operation to the patient is that it gives every patient the chance to achieve continence.
UH Rainbow is initiating a very ambitious program, which is not only to have an institution starting to provide this procedure for the exstrophy patients, but also to provide a platform, a setup where this family can get advice and healthcare all along infancy, childhood, adolescence, and even later at adulthood. It's extremely important to underline the fact that these children do need access to medical specialists all along their life, because even if most of the problems are solved, they need to be followed up for a very long time to address future issues like fertility, like long-term continence, like gynecology problem, pregnancy problems. They need to find a place where there is a group of specialists like in UH Rainbow who are able to address all these different problems coming with bladder exstrophy.
Here at university hospitals, you have that unique infrastructure which can provide care from the time of birth through into their later adult lives.
What we are offering here at UH Rainbow and Babies and Children's Hospital, it's a whole journey experience for the family. So the whole family, it's affected by this condition. And the most important thing for parents is who will take care about their child after they are gone. We will.